Hey there, and welcome to Little Piggy's Foot Care. My name is Amanda, and I'm a registered nurse, and we're going to talk about something pertaining to foot care today. If you like this channel, I want you to subscribe or do the notification thingy. I'm not really a big understanding of it, but it gets you these videos, so there's that. Anyway, I wanted to say welcome. Today it's March 3rd. I've tried so hard to do this video yesterday, and the outtakes were long and arduous, and my heart wasn't in it. Let's just face it. So I have a few minutes between clients today, and I thought I'd pop on because I have a few things to share with you. It is so every month and every day of the month, there's something associated with it. So whether that be some kind of disease or some kind of organ, like your organs, or I don't know. It's this thing about health that we seem to love to do. Sorry, I'm noisy and I hate doing one thing at a time. So this month, believe it or not, now I have read, Diabetes Canada is saying that it's kidney month. I'm not exactly sure. I read liver month, so I think the problem lies where you look. So according to Health Canada and Canada's thingy, it is liver month. So, you know, you make my liver quiver, baby. So, yeah, welcome to liver month. And also a shout out to music therapists. I know music in my life has made such a huge difference, and I don't even use it. Well, I use it as therapy, but not that I pay for it. So there's been many times where I've pounded those ivories just trying to get some of the world's frustration out, right? And it's also Pharmacists and Nutritionists Month. So I want you to go over and thank your pharmacist, because without them, your life would be a little different. And same with those nutritionists. You know, they do provide such a great, they are such a great resource and so underused. If ever you have a question about diet and what's actually helpful instead of these fad diets and stuff, nutritionists are the ones to talk to. I know for this family, we'll be going to one in Zares, I think in either tomorrow or the next day. So honestly, think about it. It's a great resource. But today, you're probably going to see this on March 6th. So happy birthday to me, and happy National or Canadian Lymphedema Day. So I found this really kind of funny and interesting. I share my day of birth with a malfunction of the lymph system, which is a system in the body that kind of transports things as well as kind of throws out the extracellular kind of junk. It brings stuff to the red blood cells, then kind of brings other stuff away, things like protein and fat. It's a transport system. So if you can imagine the 401, there you go. Same kind of idea. So your lymph nodes are throughout your whole body. The main organs that are involved in your lymph nodes are your spleen, your thymus, thymus, and tonsils. And the challenge comes when something is either blocked or it's been removed. So if you can imagine taking out a section of the 401 and just taking like a mile section just completely out and stopping it there, there's going to be backlash, right? There's going to be lots of traffic back that way and potentially no traffic there. Eventually the body sometimes will kind of divert that traffic, but it doesn't always happen that way, and we end up with really thick feet. That's the swelling. So I had a medical dictionary here because I am before Google, and yeah, I know it's kind of weird. I don't get all my information from Google. I actually have a medical dictionary over here, and I'll quickly try to find it again because it was a really neat picture. So lymphedema is something that happens to a lot of people, especially as we age, and it can be a really arduous task to have. Some people end up with it so bad that they end up needing things to help them out, and it is uncurable. But that doesn't mean it's hopeless, okay? Because there's always something. So, and it is something that as a foot care nurse, I see a lot of. I've seen it affect both legs. I've seen it affect one leg. I've seen it affect one arm, I have some history in a post-surgery ward, and yeah, after mastectomies and different other things, we had edematous arms because of they couldn't have any compression to them, and yeah, the backup of lymph. So if you can see right here, you see the difference in the legs. One leg is like twice the size of the other. That's a typical presentation of lymphedema. So what ends up happening in there is that, again, we've taken out a section of the 401 and there's nowhere for that extra fluid to go. So it ends up pooling at our base of our foot. You can see here, I don't know if you can see the foot right here, but do you see that kind of lump right there? That is all swelling, and it has almost distorted the way that the foot looks if you look at both of them, right? So you can imagine that kind of weight is very heavy, and it alters the way the foot can move, and that is a very big challenge. Now, the way the lymph system uses the body to transport itself is by muscle contraction and lung pressure. So respiration, very important. That whole kind of breathing gets that lymph moving much better. So if we're taking short and shallow breaths, that's not moving things very far. It's the same thing within our legs. So we have a calf pump that's activated when we do this with our feet and then drop them down. So up and down and up and down. And now you need to have your shoes off to do this because they constrict that ability to be able to bring that foot right up and then drop it right down. So while you're doing that, that muscle is contracting within here and it's squeezing all of those vessels, and those vessels are squeezing the lymph back up. Now in the back of your knee is a lymph node. So it's squeezing all of that back into there, and it's filtering it and getting rid of it and pushing it along. Now, if you don't have that ability to have that kind of contractility on that muscle, what ends up happening is that that fluid starts to leak back down. And that's when you end up with these huge ankles and huge feet. And it makes putting shoes on impossible, finding things to fit, finding socks to fit, like it can cause a lot of trouble. So when you're sitting watching TV, put your feet up and practice that up and down, and try it like 10 times a day. Because what ends up happening is that as we age, we lose that muscle contractility. So a lot of us are more prone to that idea of pooling. And this is where compression socks become absolutely vital. Now, compression socks are something that you can purchase from drugstores, purchase from retailers. Do make sure that you get fitted properly, because too much compression can cause trouble. Too little compression is not usable, and it's a waste of money, to be honest. So there are a few different ways that you can access it here in Ontario. One of them is to have what's called an ABPI, and that's where they take blood pressure cuffs and they're trying to find the median blood pressure from between your brachial arteries and from your femoral arteries and your popliteal arteries. So you're trying to find a mean, which then gives the technician that special number that tells you how much compression is appropriate and how much compression is not. In the case of lymphedema, some things are used differently than they are for, say, venous insufficiency and different other things, right? So we're trying to affect the lymph instead of the blood, okay? So the true meaning, or the true, whatever, the medical way of saying this is lymphedema is characterized as either a secondary or a primary condition, and it's characterized by the accumulation of lymph fluid in the soft tissue. And as a result, it causes swelling by inflammation, obstruction, or removal of those channels. Some unfortunate people are born with this condition, and some acquire it after an injury to a lymph node or a removal of a lymph node or some kind of obstruction somewhere. The congenital lymphedema is called Milroy's disease, which is something I didn't know, and I thought that was kind of interesting. So, and that can occur in adolescence, and that gets really challenging because any kind of weight gain through obesity or through pregnancy, sometimes with menstrual cycles and stuff like that, that fluid kind of pressure can go up and give you the need for more compression or an ability to get rid of that lymph. If you've had a lymph node removed, like in the idea of a like say in your axillary area, which is your armpit, then that fluid that normally kind of comes up and all that muscle contractions that are coming up no longer can get it to that. So it has to somehow either get it up and over where that lymph node was or find somewhere else to drain into. So it's important in those conditions not to use a blood pressure cuff on the side that that lymph node has been taken. Okay, so if it's left or right, use appropriately. Sometimes in some extreme cases, we actually have to use like a femoral blood pressure or a different blood pressure because of a double mastectomy or something like that. So the thing is that once you have lymphedema, you have lymphedema for life. And so the idea is to try to control the amount of fluid that kind of accumulates. So you're trying to keep it down. And ways we can do that are by elevating your feet when you're sleeping by 4 to 8 inches. So that much, by about that much, or something like that. 2 pillows will do just fine. Put some pillows underneath your calves when you're sleeping and lie back and just enjoy, because gravity is going to help that fluid kind of come back towards the heart. You need to be above, your feet need to be above your heart. Another thing, they mentioned stockings, compression socks. There are quite a few different things that you can have for compression, and they're really discreet. They're no longer the really scary looking, huge bandages that take 500 people to kind of wrap around you or anything else like that. There are a few different ways. There's 3-step compression, 2-step compression. There are socks. There are stockings like nylons. There are so many different really funky ones, which I love, because March is Rock Your Socks month. So we're going to be talking about socks quite a bit. So it'll be fun to listen up to. So you want to make sure that you're getting something and light massage, because you're not trying to affect the veins, which are lower down. You're trying to move that lymph. So the big thing again that you're going to really want to practice is that up and down motion. That's going to help tremendously, and trying to increase the range of motion of that ankle by doing like a figure 8 or just by movement is really helpful. But again, that up and down motion is really, really, really vital in this case. Some really enjoy the light massage. Another thing is diuretics, but that's hard to kind of play around with, because diuretics, they take the water off, but sometimes they can take too much. Sometimes they take too little. So to balance it out can be really, really difficult. That's when your pharmacists come in so in such a great way. They can help out so much with that, and just keep an eye out for it. Sometimes they're contraindicated, sometimes it's not. So it just depends on how much you need. And so the last kind of option is surgery, to either remove a channel that's been blocked for a long time and it's become what they call hypertrophied, which means that it's kind of shriveled up and it's not working very well. And they try to kind of connect things so that it helps move that fluid. So I hope this has been informational for you guys. Lymphedema, lots. I can't even tell you how many people have it, because I honestly don't know, but it is something we don't talk about, and it is very common to see. And so so a shout out to all of you guys who are dealing with it. It's a challenge, and it causes a lot of tiredness and a lot of different body issues and different other things. But I want you to know that, first off, you're not alone. It is so very common. And second of all, most of the people who are dealing with lymphedema, guys, you're survivors. So fantastic to have this kind of information. So again, what can be most helpful to you guys is elevating your legs above the heart when you're sleeping, and just consider some compression with the advice of your doctor and your pharmacist and someone who's going to fit you properly for these socks. Don't buy them over the internet. do get them fitted properly, and they're not something that you want someone virtually doing. Sometimes it's really nice to have somebody talking to you and explaining how to use these, because they can be really helpful and they can be really hard. So, and they can, without the proper training and stuff like that, trying to pull them up, my friends, you'll end up with a black eye. So good luck to you, and thank you so much for listening. I hope you guys have a fabulous day. I know here in Ontario it's like 0 degrees outside. It's gorgeous, and it's just not what I expected at all for a March 2nd. Usually it's like we're 10 feet under snow. So go out and enjoy your day. Walking can help too. So that's great. Thank you so much for listening. See you later.